Hi mamas, my name's Sammy Kadak and I'm a perinatal pelvic floor physiotherapist, currently in my third pregnancy. And I wanted to show just a couple of postural tips or things to think about when you're standing, which can help to relieve pelvic pain and back pain, especially as the belly's getting bigger. So there's a lot of changes that occur during your pregnancy. We've got the increasing load of baby and that changing center of gravity, which will tend to pull you forward. And then you also have all of these wonderful hormones that create a little more softness or stretchiness through the joints. So this can increase the amount of pressure that you might feel through those joints, and it increases how much more the muscles around the pelvis and the lower back have to work just to provide that extra support actively rather than the passive support from the ligaments. So this is one of the common postures that I see during pregnancy, which is belly is starting to pull your pelvis forward. And so I'll see a lot of mamas hanging out here. But what this does is create a bit more pressure on the pubic symphysis. It can create a bit more load and stretch on the linea alba, so contributing to abdominal separation at the front. And then it switches off those big supportive muscles of your glutes, your hamstrings, and your pelvic floor is at a disadvantage as well. So the simple fix here is to try bringing your weight back into your heels so that you feel really grounded through your heels, not tipping over. You might have noticed that as I came back, I didn't just lean back, though. I have to actually untuck my pelvis so that it's back in what I think of as a more neutral position to help get that weight through the heels and feel grounded. Now, the long bones of the legs, the bones of the pelvis are taking more of that load. There's a bit more activity through the bum, the hemis, the pelvic floor can work more effectively. The abdominal wall is just gently engaged, not gripping. And there's less stress and pressure on the tummy and the pubic bone. So when you get a chance and you remember, try it out and see how that feels for you. The other common thing that I see is the rib cage flaring up. And I can definitely appreciate this at the moment because there's not a lot of space to breathe. So it feels like lifting the rib cage and flaring the ribs up can help you get a bit of a deeper breath. And so sometimes I see that just on its own. Sometimes I see the pelvis forward with the rib cage flared. And it does feel like you're creating a little bit more space. Unfortunately, you're shortening the distance at the back. You're creating the space at the front, but we're creating more, again, load through the front of the tummy. So that could contribute to abdominal separation. And you're more likely to get a lot of tension or pain through the mid part of your back if your ribs are flared all the time. So once you've got that stable, stacked base, check in with your ribs as well and see if you can keep them relaxed and just directly over top of the pelvis rather than sticking up and thrusting forward. So that in particular is helpful for upper back pain and abdominal separation, allowing the abdominal wall to engage better, and your pelvic floor works so much better when the ribs are stacked over the pelvis that way as well. So I hope that's helpful. Try it out. If you have any questions, leave them in the comments below, and I'll see you soon.